So welcome to Taking Charge of My Cancer podcast, episode 19. I am Dorly Munoz, your host, and I have a pleasure to welcome Maureen Macbeth. So Maureen joined Impedi Med in January 2022 as the Key Account Specialist Rehab. And in this role, she uses her 27 years experience as a physical therapist, specializing in lymphedema and cancer rehabilitation, to promote the prospective surveillance model of cancer in the oncology space. Having worked with bioimpedance spectroscopy technology for over 20 years, Maureen has great insight into the use of bioimpedance in the early intervention and prevention of chronic cancer-related lymphedema. She's passionate about implementation science and evidence-based medicine. Maureen is an active member of the lymphedema community and is a member of many organizations, including the APTA, LE&RN, ISL, AVLS, NLN, and ACRM. Maureen was a CLT, which is a lymphedema certified training instructor for 15 years and is still speaking at conference and continuing education programs. She's been involved in a long-term volunteer project to help advance lymphedema care in Cali, Colombia, and supports the many lymphatic advocacy efforts in the USA. Oh my God, I didn't know that. I'm from Colombia. That's amazing. How about that?
You are?
I am.
Oh, yo soy Colombia.
Oh,
I don't speak great Spanish, but all the Spanish I've learned was down in Cali, Colombia. So I've been told I have a Calenian accent.
Oh, wow. Look at that. Well, welcome, Maureen, and thank you so much for doing this with me today.
Shirley, thank you for having me. I'm so excited. And now we have something else. We'll have to go to Cali together.
Absolutely.
I have wonderful colleagues down there. I have just the best colleagues down there.
Awesome. Oh my God, this is so exciting. Look at that. You know, we have to come down to doing this podcast for me to start learning more about a lot of the people I work with. It's amazing.
Right? Well, that's why I loved your questions, by the way. They were really fun to have to, think about, right? And just, do I want to be super serious, or do I want to show a side of me, or that whole breadth, right? That who we are as people. And exactly. So I hope I found a balance for you on that. But
absolutely, yes. And the whole idea is to be able to give some, of course, education to our audience. And this is the whole idea why I'm doing this. But I want the audience to know that, yeah, we're human beings, and then we do as well fun stuff, and we get involved, and we get stressed, and we get other issues as well. So it's not just like, it's not like the healthcare team is perfect and nothing happened to them. So I kind of wanted to see the both sides on us as well.
I think that's so important. And I mean, I think that's been one of the reasons that I feel like I've been a good clinician over the years, is that I'm not like a step above anyone, exactly. I'm with them.
Exactly. Yeah. So lead us into the first question. Tell us about your mission. How did you end up doing all these wonderful things that you've been doing with your career?
Oh, that's, so I'll talk about that a little bit more, but really my mission, once I found out about bioimpedance, and that was a long time ago. It was actually before I became a physical therapist. We had a family business selling. My dad and mom had a business selling like Chattanooga equipment and all this stuff to set up a PT office in a hospital or a private clinic. And Chattanooga had a little bioimpedance analyzer. It was just single frequency, and it would do your body composition. And, we would sell that. And so I remember working with this bioimpedance. I thought it was so cool. So when I became a CLT, I was working at UPenn in Philly at the time, and I knew nothing about lymphedema. I was working on the cardiac team, and I thought that's what I wanted to do with my career. I finally found my space. And then one of my colleagues was pregnant, went to see the OBGYN at lunch one day and didn't come back to work. She was put on bed rest, and I got sent to the oncology floor, not knowing much about oncology. A week later, I was hooked, and then I was also told I was going to stay there because she wasn't coming back. And not long after that, my boss, called me into the office and said, "You've got to go get lymphedema certified." And I was like, "No, I'm not doing that. I have no interest," right? It didn't matter. I was told that I had to do that. So I unwillingly, got all this information. And I'm not kidding when I tell you that one article that the Foley's wrote in the Lancet changed my whole worldview. I mean, I still get goosebumps thinking about it. And so when I found out about the lymphatic system, I all of a sudden realized, like, this is what's wrong with medicine, is that we're not educated about the lymph system. And I even thought about all my cardiac patients. I remember the time I saw someone with, they had nicked the thoracic duct during a thoracic procedure, and they had a JP drain coming out of them. And I went running down to the nurse's station saying, what's coming out of this drain? It's this milky white substance, right? And it was Kyle. It was just amazing, right?
Wow.
Yeah. And so when I was at UPenn, there's a very famous Dr. Andrea Chaville. You know, she's world renowned in the cancer rehab world. She's at Mayo Clinic now. And Dr. Chaville had one of Impedi Med's research devices. It was called the SFB7, and it was in this metal case and looked like it should have had a handcuff or something. It said, investigational use only. And she was doing research with it. And she let me come up to the lab, and I got to see this. About a year later, I left Penn and just was very lucky to get a job down at Mercy Medical Center in Baltimore, a community hospital that had a huge breast cancer program. They had 3 full-time breast surgeons, 2 full-time plastic surgeons back in 2005 doing deep flap reconstruction.
Wow. Yeah.
And they were already doing preoperative baseline measurements. So I went down there and, of course, told them that I wanted to get this device.
Mm-hmm. I remember that.
Yeah. So by 2007, I had a research device, had to go through IRB and started testing people with this. And, I understand, like, in the diffusion of innovation, I was very much an early adopter of this technology. And some people thought I was just, plumb wrong. But I really stuck to it because I really felt like, with everything we learned from the Foleys, right? I have my Foley textbook of lymphology right here. It's never far from me. One of my favorite books, but I didn't count it in my books today. But, I just thought of everything in there and just said, we have a chance when patients have cancer treatment because we know it's coming. Why aren't we doing something now to prevent it more or do that early intervention? So I was just hooked. Yeah. And that's been my mission in life, is to do that.
That's awesome. That's so exciting to see how this whole thing started. I've been a PT for over 33 years as well, but oncology within the last 14. And I remember when we started with Dr. Singhole, UF, doing a lymph node transplant, he's like, well, you need to find out what is the top things we need to get. We're going to do this, we're going to do it right.
Yeah.
And then I started doing some research, and I found Lisa at that point with bioimpedance, and I'm like, Lisa, well, how can we get this? And so they came, they showed it to us, and then, it's like, of course, I'm at that point, and I'm just a staff PT, like leading the oncology program and talking to my manager about, I need you guys to buy this device. And they were like, well, no, we don't have the money. And then that was the good thing about, like, talking with Dr. Singhole. And I'm like, well, they say they don't have the money. And they were like, what? No, who is these people? And let me go talk to them right away. And all of a sudden, within 3 weeks, we have the device here.
Nice.
And it has been amazing. We've been doing a prospective surveillance program for maybe 10 years.
Yeah.
It has been amazing.
Yeah, you were one of the other early adopters,
Yeah. So that has been amazing. That's awesome. So were you planning to be a PT before?
No. No, I think the first thing I wanted to, apparently the first thing I wanted to be was a garbage man. When I was a kid, that was apparently my dream job. But as I got a little older, I actually thought I wanted to be a doctor. And then I was a ski patroller as a teenager, loved first aid, all that. And then I went to college, and I had one of those terrible first years. I just didn't do well. I didn't like it. I didn't like the kids in my bio program, so I became an English major. And I ended up getting my degree in English and teaching. So I wanted to be an English teacher then. And then there were no jobs. And that's how I got into my family business selling physical therapy equipment, because my dad's like, it's August, you still don't have a job. Why didn't you come work for me? And about a year after working with a bunch of PTs and OTs, working with rehab people, it's like, oh, they're really nice people. And I love what they're doing. So then I had to go back and get on my science prerequisites. And it took me 6 years at night.
Oh,
And yeah, so I didn't graduate PT school till I was 30.
okay, awesome. But I'm so glad you found the right path. That's
Oh,
awesome.
yeah, I can't imagine. But even once I became a PT, I didn't really know what I wanted to do. I went back to surgical sales for a little bit of time and then just realized that wasn't for me. I really missed the patient care.
Got you, got you. So would you give us 3 valuable tips that have you learned in your journey for our audience?
Absolutely. I don't know who first coined this term, but it's one I think is so important. It's know your value. And I think especially as rehab professionals, we're often thought, well, you're not a doctor. Well, I'm glad I'm not a doctor because a doctor can't do what I do.
Mhm.
So know your value and know it as a human being in general as well. I mean, I think that's the thing for me, getting, to travel all over the world with lymphedema things and see people in many different cultures, socioeconomic situations and everything. And it's that value of how important every human being is
Okay.
really big. And then, make mistakes and keep moving forward. I think mistakes are critical. It's funny, in the background, I have this thing, I try, I fail, I learn. And it's this one company in Wales that makes denim. And it's funny because one of their other mottos is my last thing I'm going to say, but they always talk about, make mistakes. I mean, that's how we grow and learn, and we accept them. We acknowledge that we were part of that, and we have that self-compassion too. Not just empathy, but self-compassion, because we're all really hard on ourselves. Most of us, most of my colleagues I know, we're just so tough. We try to go to sleep at night and we just think about all the things we didn't get done during the day.
Mhm.
So we have to do that. And so one of my patients, back when I had a million different ideas and all the things I wanted to do, her name was Elizabeth. She said, Maureen, you need to pick one thing and do it well. And so that's when I decided to start to whittle things down and go in this direction of bioimpedance, right? Of that being my one thing,
Okay,
and doing
perfect.
it well.
How about your most painful lesson?
Oh gosh, that it has to be that sometimes you have to let go things, even when you've built them and you've put your sweat equity in it. To take some line from Habitat for Humanity, like, you have to remember, even when you're building a program. So I built a clinical program and I had to let it go. It wasn't serving me anymore and I wasn't serving it, I think. And remembering that it's basically only a building, right? It's the people in the building that make the
Mhm.
home, the house,
Mhm.
whatever. So you have to be able to let those things go
Mhm.
and move forward. Yeah.
Yep, yep. I feel you. And it's funny when we were doing our lymph node transplant program here at UF, and Dr. Singhal decided to go back to Harvard,
Yeah.
Beth Israel. I'm like, no, please
Yeah.
don't go, don't leave me. And then he's like, well, and I understood the reasons, but then he's like, will you be able to train the therapists I'm going to work with in what we're doing? And it was so hard to let go of my baby, right? Like we
Yeah.
did this together. What did you mean?
Yeah.
You want me to just hold them and has a meeting over the phone to tell them everything I've been doing for years? I'm like, that
Yeah.
doesn't make any sense. And like, no, I
Yeah.
will, but I don't really have time. And I just keep putting on the back burner.
Yeah.
And then
Yeah.
finally, I'm like, you know what? Again, I'm glad that other institutions have the program, that other institutions have him, and
Yeah.
wonderful. But yeah, I can totally see where you're coming from when you have to let go. Yep.
Yeah,
Yep.
yeah, and it's hard, and because you don't want to suffer yourself, and I can only imagine, like, for people who don't know Dr. Singhal, I mean, he's just one of the nicest people on the planet,
Oh my God.
and
Yes.
he's
Yes.
brilliant, and he's humble, and he's funny, and he's just, he's someone you want to just be around, and that would be like the worst breakup.
Yes, yes. This is like every
He's
and
so
then
sad.
he's like every time we see each other, it's like it was like he just left us. So
Yeah,
yeah. amazing. He's
Yeah.
amazing.
Well, I think you've done a great job training them, because the other people, and you know what's so funny? So ask me the next question, because this is kind of what we're almost talking about right now.
Okay, so how about your most painful? Oh, that was the painful lesson.
Yeah,
That
yeah.
was anything that you have that will be valuable to our audience.
Yeah, and I think one of that things, it's about connection, right? It's about like remembering to connect. If you're having a bad day, if you heard something from your doctor you didn't want to hear, the most important thing you can do is connect. I mean, that's what we're really here for. I literally have goosebumps right now, and I'm actually tearing up a little, because I think connection is actually the essential force in the universe. I think when things aren't going well, it's because people don't connect. You know, when we think about war, it's because there's a disconnect. You know, when we think about violence in the home, there's a disconnect. When we think about, you know, just what's not going right in societies, it's a disconnect. And I think when people start to come down to it and they can just connect with each other, that's brought me the greatest joy in my life and in my career. Was no matter what was going on with that patient who walked through the door, or a colleague or whomever, if I was able to find one thing I could connect with them, or, you know, someone on a subway. I mean, I had an experience one time where there was a kid who I didn't think he had good intentions when he got on the car, and I was the only other person there. You know what I did? I said, hello. I said, how are you today? And it took him off guard, and he had to respond. And then we talked the rest of the way. I think he was going to mug me. I really do. Like he kind of, he looked all, you know, like tough when he first came on. And I've been mugged before. I didn't get a chance to talk to them. But I think connecting. And so, do you remember those toys, Tinker toys? They were the little wooden. Yeah, I've always said, like, that's what I want to be, is I'm a Tinker toy. That's my role in this world.
That's awesome. That's
Yeah.
a very good advice. And you're right. I was just talking to somebody yesterday, and we were talking about how, you know, sometimes we want to do things alone, right? And we go through this journey, and we were like, okay, we really don't want to be bother people. I don't want to bother my family. I can manage this by myself. And how important is like to have that support and that community and that connection for things to kind of look a little bit better. I know sometimes when we have news with a cancer diagnosis, you know, I'm sure the whole world comes apart. But sometimes when you start to really looking more in depth and start to create those connections and that communication and allow people to help you, that really makes a big difference.
Yeah, I've felt that in my whole career. And I think that's when people always have said, oh, isn't oncology just like depressing? I'm like, no, it's actually probably the place I've found people having more real conversations, more real connections than any place I've ever worked before.
Totally agree. Absolutely.
Yeah.
Agree. Yep. Yeah. Absolutely agree. How can people find you?
Oh gosh. Google me, and there's only two Maureen Macbeths. The other one is an accounting professor in Chicago. It's so funny. And she used to like to run too. So I think she's a little younger than me. I think we look alike too. So I've got to go meet her sometime. But in all seriousness, like I don't block many things. So you can find my phone number on Google. But I'm on Instagram, I'm on Twitter. So like it's at Maureen Macbeth on Twitter. I think it's MMacbethPT on Instagram, and I'm on LinkedIn. So, you know, I've always, and my phone number, I mean, you can give people my phone number. I've always just been, you know, you can get to me. So.
Okay, perfect. And I will put that information on the description of the podcast so people can see it.
Please do. Thank you.
How about 3 books that you will recommend?
Okay. So I have them here. I don't know, is this visual or not? Or will people be able to see it? No, it's not. Okay. All right. They won't be able to see them. But one of the books is a wonderful book called When Things Fall Apart. And it's heartfelt advice for difficult times. And it was written by this woman, Pema Chodron, who's a American Buddhist nun. And I love this book because I think you need to read it when you think you're on top of the world. And when you are in the depths of despair, I think you should read it also. It's a book that I read probably 20 years ago, and I've always just kept it by my nightstand. When I just need some clarity on something, I'll open it up and, you know, like it was funny because today one came up, I had a bookmark in here and it was like not causing harm, you know, and it's, It's a transformative experience to simply pause instead of immediately filling up the space. And like just words like that. Yeah, so it's a keeper, and it will have a lot of bent pages. The second book is actually one of my dear friends and just wonderful person in this world. Her name is Lisa Levitt-Gainsley, and she's a massage therapist who's also a CLT in the LA area. And she wrote a book called The Book of Lymph.
Okay.
And the Book of Lymph has been translated into 17 languages already.
Oh, wow.
Yeah. And it's really a labor of love on Lisa's part. Her mom died of cancer when Lisa was 13. And her mom had done a lot of like healing work with the kids, really. And Lisa went on a journey all over the world to learn the healing arts. And she really settled upon the lymphatic system as the one that really has the most capacity to help humans. And she wanted to write a book that was accessible, not Foldy's textbook of lymphology, because most people that would just hurt them if they dropped it on their foot. It's so heavy, And so the little book of lymph, it's a wonderful sized book, and it's got all these self-care activities people can do, but it talks about the history of the lymphatic system and focus on self-care that people, even with a normal, intact, healthy lymph system, can do. So I just love it. It's a great book. And then you're going to laugh at my last book, but most people who know me know that I'm going to show it to you, but I love birds. And one of my colleagues gave me this book, and it's called What It's Like to Be a Bird. It's by this man, David Allen Sibley, and he's also got a great bird guide. But this is a great book. It just says like what birds are doing and why. And it's like a picture book too. So it's really fun because you can look at pictures, like kids could look at this, adults could look at this, but it tells you about the science behind things and kind of just, it's so cool. And I'm a big fan of just understanding our part in nature, and that really helps our human experience too. Because and birds are everywhere, down in Colombia, everywhere you go.
Yes, that's awesome.
We could go bird watching down there someday.
Exactly. That would be awesome. Let me see. How about movies?
Oh my gosh, movies. Now I'm going to really show my silly side. But I don't have dogs. I have cats, but I grew up with dogs, and there's a movie called Best in Show, and it is hysterical. It's just one of those movies you can watch over and over, and you'll keep finding things that you didn't see the first time. And it's by that group of actors who they do a lot of improv, and so it's so funny. So it's supposed to be like it seems like it's almost like a documentary. They're following these people around going to the Westminster this mythical dog show in Philadelphia. And it's just super funny. So watch it. Maybe you'll laugh. People either love it or hate it, but I've always loved it. And I actually think what's really funny is that I think the connections again with the animals, the humans almost mirror the dogs. So when the person's anxious, the dog's anxious, and it's just so funny how they do that, but it's great. Yeah. And then, there's another, it was just on the other night too. And when we were on vacation, I remember my mom watched it with my wife and I. It was so funny. It's called Legally Blonde. It's an old movie, right? It's like comfort food. It's like you watch that and you laugh at every scene still. And I love Holland Taylor playing the really tough, professor, but I like it because it's very pro women, like strong women characters, and the good people win.
Yeah, that's a winner. Yeah, I love that movie as well.
I watch scary movies. And you know what? I'm such a little dork, but I love Star Wars, the original one, like the original Star Wars movie. I can watch that over and over and over. Don't know why. So I'm not really into sci-fi, but I love the original Star Wars.
Okay, awesome. How about podcast?
You know what? This is bad. I don't listen to a lot of podcasts, but yours is now going to be on mine. Yeah.
All right.
So I love it. Yeah. And I'm going to stick with, also in this field, there's two other, one of my patients started one called Spotlight Lymphedema. And she there's about 15 episodes, I think. I don't know if she's done one since last year. It's been hard. But she just gives such a good, honest look into what it's been like having lymphedema, and she brings on just wonderful guests to talk about their experience. It's so heartfelt and really informative too. So I really like that. There's another one just kind of in the business. One of my former students started one called OncoPT.
Yeah.
And Elise gets a lot of great speakers on. So I just think it's, she's had a couple hundred episodes, but it's great because you can go back and listen to what Nicole Stout said or what Katie Schmidt said, and, the big people in the field. So I think that's really good.
Yeah, I follow that one as well. It's pretty good. Excellent. Very good. So something just kind of like popped in my head. We've been talking about, bioimpedance, and I don't know if our patients know what bioimpedance, is. So will you explain in line words?
Sure. Yeah. So what's the thing I always tell people is if you've ever stood on one of those scales that told you what your body fat was, for example, or how much muscle you have, like one of those little home scales, that's actually using bioimpedance. And bioimpedance is been around as long as electricity because it's a low level current and it runs in different frequencies. And in our case, bioimpedance spectroscopy, the technology that Impedi Med uses, takes 256 frequencies and scans your body's tissues. So when you get on the SOZO, your hands are on the metal plates and your feet are on the metal plates. And those are actually electrodes. And the current goes from your arm to your other arm, from your one arm to that same leg, from leg to the other leg, and from arm to leg on the other side. And measuring all those different things, we can actually tell, because of the different frequencies, how much extracellular fluid you have in your body. So extracellular fluid is the fluid that's around all your tissues. So it's not literally within the cell membrane of all the trillions of cells you have in your body, but we can also measure intracellular fluid. With all those things, we can actually calculate, that's how we get the LDEX score. So that lymphedema index score is on what's called a standard deviation, which means like people who are within one standard deviation, 68% of the people are in that space. So we can tell based on population if you're where most people are, or if you're starting to get, I call it far off plumb. And so that's what our technology can do. And it can do it really rapidly. It's non-invasive. You don't feel it. So if you've ever had an EKG, it's like an EKG of your whole body.
Perfect. That's a perfect explanation. Yeah, sometimes that was a very well, I explained part of it very similar to you to try to, for patients understand every time they come, and then that's how part of what we do as well every time they come for surveillance. Yeah, that's a very good explanation. So it's one question that you wish I would have asked you, and will you have answered it?
Well, I'm going to change that now. So I think it's going to be what's my favorite thing to eat down in Colombia.
That's perfectly fine.
But I love pan de bono. And I make my own pan de bono.
Oh, wow.
I learned how to make them because I love them so much.
You have to send me the recipe.
Yeah, I'll come make them for you sometime.
Oh, absolutely.
But no, I really can't think of anything else other than, maybe I was really trying to be serious about the question, not about the pan de bono, but it was really, what would my hopes be, right, for the future? And so I think, had you asked me, like, what am I still hopeful for? One is for a true understanding and recognition of how important cancer rehab is for any patient diagnosed with cancer. It can't just be the lucky ones who get it, or just because one place has a good program. We've got to make it standard of care.
Mm-hmm.
And, that's kind of, I know I'm really working on this piece with preventing cancer-related lymphedema, or preventing the progression that leads to chronic lymphedema. Mm-hmm. But I'm trying to, anytime I get to talk about it, also add in there the whole cancer rehab piece. And I do think even our technology will be important with that, because we can do the body composition. So hopefully down the road, we'll be able to really push that and say, hey, at time of diagnosis, I don't care what kind of cancer you have, I want to get you on the SOZO. If you're at risk for lymphedema, we'll screen you for that. But otherwise, we're going to find out what you're really made of right now. And if you're sarcopenic, for example, we're going to get you an exercise program right away. And that's really my hope, is that we'll see that before we retire.
Awesome. Actually, we do a combination, right, with body composition, because we have the Impedi as well.
Okay.
to, before when we started this also was no body composition.
Yeah. Yeah.
When we did the whatever, what was UB100,
You,
whatever.
yeah. The U400. Yeah.
The U400. So we end up getting an Impedi because we felt that the body composition was super important for
Yeah.
lymphedema risk as well. So we're still doing both, and then we're still going back and forth between both, but has been a really great tool for education on as a pre-op, right? So they start having patients realizing, man, how can I improve my body to try to either face these treatments I'm going through or hopefully help for, I don't know if I can say avoid it, but how can I just really prevent for this recurrence to happen?
Yeah.
So
Hey,
it's a very powerful tool for us.
Yeah. I mean, think of, Katie Schmitz's book, Moving Through Cancer. I mean, we know there's so much research out there that people really can do something about decreasing their risk for recurrence by exercise. So I think it has to be medicine. I think it needs to be prescribed more often. And I love that you guys are doing the body composition analysis. I really do.
Yeah, that has been working really well. But
That's
Beth,
great.
it was so much fun to have you here.
Darling, thank you.
We need to talk more about Colombia. Love to know what your experience has been there. So yes, definitely we gotta do that another time in a podcast. But just I'll call you and then we can chat about it.
Absolutely. And thank you for doing this. I just think this is great. I do really feel like bringing, the people you're bringing into your podcast, it's making the world a smaller place and a more connected place. So thank you.
No, thank you. Thank you so much. And thank you for being part of this. I'm
Absolutely
very excited. And this has been really so much fun to do. It's so fun to talk to people that you've been connected and people that you have been working with, patients who are either survivors or dealing with it or, stage 4 or whatever. So it has been really, really fun. So thank you for being part of it.
Thank you so much.
Okay. You have a great evening.
All right. Take care. Bye.
Bye.